Hello, and welcome to the OmniHealthData Insights demonstration of the Quality and Patient Safety Info app from Information Builders. Looking at hospitals across the United States, 78% receive a readmit penalty, 22% receive a hospital-acquired conditions penalty, and 45% are penalized under value-based purchasing. The need to monitor quality and be able to quickly target improvement activities with precision is a must-do activity for providers today. OmniHealthData Insights is a suite of 5 powerful info apps that are pre-built for hospitals, integrated delivery networks, and physician practices. They were developed on the award-winning OmniHealthData platform in partnership with St. Luke's University Health Network, a fully integrated and nationally recognized 9-hospital system with 270 outpatient locations. Among their 120 healthcare quality awards, they have earned the Truven Top 100 for the 6th time and consecutively for the last 3 years. In addition, they are a Truven Top 15 teaching hospital and have won the Drexel Analytics 50 Award for their innovation and analytics. Truven makes these designations for excellence in clinical and operational performance by analyzing nearly 3,000 hospital systems. St. Luke's is also recognized by U.S. News and World Report for Best Regional Hospitals and have achieved the HIMSS Stage 7 designation for its entire system. This video is an overview of the capabilities available in the Quality and Patient Safety Info app. There is a wealth of knowledge inside this application. For example, Patient Safety Events provides access to 180 event types, and Core Measures analyzes dozens of clinical metrics by category, facility, unit, attending physician, and surgeon. Additionally, you have access to dashboards, scorecards, and easy self-service reporting for oncology, outcomes with observed to expected measures, infections, patient safety indicators, and women and children's services. We leveraged 10 different internal and external data sources, which were cleansed, enriched, and harmonized to support these applications and the capability to achieve advanced analytics from one source of truth. By bringing together patient safety events and timekeeping data, you can accurately correlate safety events to staffing levels. If you model cost and quality data together, you can reduce costs without impacting clinical outcomes, and target pay for performance activities that increase your score in the maximum number of rankings in publicly available systems such as Hospital Compare, U.S. News and World Report, and Health Grades. The Quality and Patient Safety Info app can be readily leveraged by the Chief Quality Officer as well as the other members of the C-suite, service line administrators, clinical quality improvement coordinators, department heads and nursing leadership, infection control, risk management, clinical analysts, and physician leadership. Now, let's take a look at the Info app. We can see from our navigator that the Quality and Patient Safety Info app has the 7 subject areas previously mentioned. Let's first take a look at the safety events. Looking at this particular dashboard, we are leveraging data visualizations. These interactive charts are one of the key ways to gain insights without having to query or manipulate lots of data sets manually. A quick glance at this tells me, by harm category, one of the things I want to focus in on are those events that are actually causing harm to our patients, versus those event types that are evidently no harm or near misses. As I drill in on this particular section of the ring, I immediately notice that the number one category by far that is causing harm to our patients is infection. All hospitals who report their data to NISHN know the importance of effectively managing infection. When we drill in another step, we notice hospital-acquired infections for GI and UTI are occurring more often than other types. I can also drill in further on those if I want more detail for each. We may wish to create process improvement initiatives to reduce infections for GI and UTI. But first, let's look at some other things to gain additional insights. Investigating time frame, we start with day of the week, but we are not seeing any particular outliers across the 7 days. However, if we look at time of day, one of the things we will notice from a charting standpoint is that most of those charting activities are happening between 12 a.m. and 3 a.m. One reason for that might be that things are quieter and we are taking more time with charting, or it may be that the patient safety events actually occur during these small hours of the night. Now we have specific areas that enable us to ask those questions and collaborate with the hospitals or units to better understand whether there is a particular problem, training is needed, or if we need to look at staffing levels for that time period. Looking across the bottom, we have event rates and counts by month and by site. We're not seeing any particular outliers by month for count of events or for event rates. But if we look at things by site, we see that Columbia Medical Center has the highest actual event rate. Let's drill in and identify which care areas or units are seeing the highest rate of events. The 4th floor cardiac care unit is seeing the highest rate of events, so let's look at counts to see total impact. Observing counts by events by site, we see that Jeff and Cynthia Rothschild Hospital has a very high number of events, but they are also our largest facility. And we can also drill in here and determine if there are certain areas of focus by unit for further study or improvement activity. If we focus on the lower right-hand chart, it is arranged to easily look at all events by type. Although we looked at infections as the highest harmful event type, here we can see that falls is the highest overall event. And with a click, we can learn more about which types of falls are occurring most often. There are a number of different categories of falls we see, but by far, patients found on floor is the prominent harmful event subcategory of falls. This prompts several questions. Are we properly documenting reason for fall? Are we simply using this as a catch-all category when we should be using others? Was there a delay in response time to calls, which caused patients to get out of bed without assistance? It's important to leverage these visual insights to go ask more questions and try to drive improvements or changes in behavior. Now, we can take those two primary insights that we have gained in this visual analysis around falls and infections and apply that as filters to the dashboard view to narrow things down to just those two categories and resubmit to update our dashboards. We can see that as we narrow things down, we are now working with 34% of the events causing harm to the patients within these two event types. It also confirms that there is a more significant outlier in the 12 a.m. to 3 a.m. charting time frame. We can also look at this information from a pure reporting standpoint. The default report is showing events, patient days, and the calculated event rate by facility. However, these reports are also interactive, so we can drill to a specific facility and see the care areas below. We could continue further in that drill path, or we can leverage the filters, as in the previous example, when we were looking at visualizations to try to narrow information down by site, by care area, general event types, specific event type, and harmful categories. We can do that by time frame and other factors, and simply resubmit that information across the board. We have looked at inpatient charting and data visualizations, as well as the associated reporting. Now we're looking at the patient safety office charting. We can quickly see with this trend line total events by month versus serious events by month, and so forth. All of the same filters and parameters, as well as date range, are available. In addition, there is oncology-specific reporting, which is also parameterized and easy to filter and drill through in this interactive report. Now, let's take a look at outcomes. We can further isolate areas such as average length of stay, mortality, and readmissions in this dashboard. We can look at actual versus expected, as well as the various indices for these metrics. The intent is to keep an eye on those metrics that affect reimbursement, especially in the area of penalties. There are a number of ways you can slice the information to look at facility performance. For example, we can choose which campus we want to look at. Let's choose Jeff and Cynthia Rothschild. Now, all of those charts update specific to that campus. We can also choose a specific fiscal year, such as 2017. All of the charts are now updated by that fiscal year by that campus for further investigation. We can look at the interactive reporting of this information as well as the visualizations. This report contains the same information that was in the dashboard, but in detail form. We can look at the specific metrics across certain categories with the ability to drill into lower levels of detail. Let's say we want to look at Columbia Medical Center and drill in further. We select the surgeon group and follow the hierarchy of drill path to lower levels of detail. This will take us down to the surgeon level. We can also leverage the filter panel on the left-hand side in the same way we have in previous examples. For example, let's use payer group and look at Blue Cross. Once we submit, the report becomes specific to that payer, and we can see the filters in effect in the bottom left. Very handy to help with payer contract and performance programs. We can do this for all areas, including average length of stay, mortality, and readmissions, all with the same flexibility and speed. We also have the ability to do completely custom and exploratory self-service reporting. This application drives the ability to choose what we want to see in our report. For example, this is a report that is sorted by campus and giving us certain information across fiscal years with the count of encounters. In addition to looking at things by campus, let's also look at them by attending physician. Let's also bring in measures for average length of stay and mortality. With a quick resubmit of the report, we can get detailed data based on the choices we have selected as an end user and follow up on actionable insights we may have gained from using charts and visuals before. This application can support hundreds of thousands of iterations of a single report, which saves overhead for high-cost report development areas and saves time and empowers clinicians and administrative leadership. Now let's take a quick look at core measures. This allows us to look at core measures by category, measure within category, entity, and many of the filters that we utilized in previous examples. Within 5 or 10 seconds, we can quickly see how we are doing across all of our hospitals and the measures applicable for each by glancing down the rate column. We're doing quite well overall, but for example purposes, we can see that the rates are not what we would like for comprehensive stroke, hospital-based inpatient psych, perinatal care, and sepsis measures. To dive into any of these areas, we can update the filters on the left or easily create our own drag-and-drop reports and views through self-service, all easily for nearly 250,000 encounters. The OmniHealthData Insights Quality and Patient Safety Info app will help you discover insights to drive improvement initiatives which can lead to reduced care costs, improved clinical outcomes, and increased patient satisfaction and retention. It is developed on our award-winning platform, OmniHealthData, which provides comprehensive healthcare information management, bringing disparate data sources together, enriching them with appropriate healthcare code sets, and cleansing them so that you have the most trusted decision points possible. It is one of a suite of 5 info apps developed for providers, and regular releases ensures your organization stays updated as healthcare measures continue to change. This would not be possible without our many healthcare industry customers and our co-development partnership with St. Luke's University Health Network. Additionally, our customers benefit from over 40 years of industry leadership, award-winning customer service, and the most advanced data and business intelligence platform technology, thanks to feedback of tens of millions of users from all industries across the globe. We look forward to following up with you to help answer any questions you may have about how this suite of info apps and OmniHealthData Insights can help your provider organization meet the challenges of modern healthcare. Information builders. Better data, better analytics.